Hi everyone, I'm Stacy Doman, registered dietitian and founder of Berries and Oats Nutrition. Thanks for stopping by my channel. Today I will be answering some of the most pressing questions that patients who are taking Wegovy and other anti-obesity medications have on their minds. We will be talking about what Wegovy is, how the dosing for semaglutide works, and finally, the potential side effects that one might have while taking anti-obesity medications. So, let's get started. Here's a fact. About 74% of adults in the US are clinically overweight. According to the Center for Disease Control, that includes nearly 43% of people who are considered obese. The standard treatment for overweight and obesity is lifestyle therapy, meaning working with your healthcare team, which includes a reduced calorie healthy meal plan, physical activity, behavioral intervention, and getting enough sleep. Now, if you've worked with your doctor and a dietitian, there is now an ability to add medications in addition to the lifestyle therapies we just talked about. Pharmacotherapy or anti-obesity medications are now able to be used with lifestyle modifications to produce greater and more sustained weight loss when compared with lifestyle modifications alone. In clinical endocrinology, the current guidelines recommend that the combination of lifestyle interventions and medication be considered for all individuals with a BMI of at least 27, if lifestyle therapy fails to halt weight gain. It is also recommended for individuals with obesity stage 2. Anti-obesity medication should be used on an individualized basis when working with your healthcare team. FDA-approved medications for the long-term treatment of obesity include 6 weight loss drugs: semaglutide, Wegovy, liraglutide, Saxenda, bupropion, naltrexone, Contrave, orlistat, Zenacal and Ally, setmelanotide, Wegovy, phentermine, topiramate, Qsymia, and the US FDA-approved Zepbound injection for chronic weight management in adults with obesity as well. So currently the clinical guidelines is if you are over 30 BMI or if you have a BMI of 27 plus a comorbidity like high cholesterol, cardiovascular disease, diabetes. Currently, Mounjaro is also on the market, and it has been shown to help patients manage their glucose. But in this episode, we'll be reviewing semaglutide. So, what is Wegovy? Wegovy is the trade name for semaglutide, and it is approved by the FDA to treat obesity. It is also that semaglutide is also under the trade name Ozempic. However, Ozempic is approved to be prescribed for people with type 2 diabetes. So, let's get into it. Wegovy is the drug class GLP-1 receptor agonist, and it's indicated, as we've just talked about, for patients with a BMI of 30 or 27 with comorbidities. Wegovy is considered a long-acting versus a short-acting GLP-1 receptor agonist. Long-acting injectable GLP-1 RAs offer the advantage of once-weekly dosing because they have a longer half-life. This is important because many times patients on GLP-1 RAs are on other injectable drugs like insulin, and this decreases the number of daily injections. The mechanism of action of long-acting and short-acting GLP-1 receptor agonists is the same, and the biggest difference is how frequently they have to be dosed. Long-acting GLP-1 RAs are better suited for patients who have a high fasting blood glucose level. Examples of long-acting GLP-1 RAs include albiglutide, dulaglutide, and semaglutide. An example of a short-acting GLP-1 agonist is Saxenda, which is a daily injectable medication. Now you know the difference between a long and short-acting GLP-1 RA. Let's get into information about the dosing of Wegovy, or the standard. The standard Wegovy dosing schedule. The gradual dose escalation in the Wegovy dosing schedule is essential to minimize gastrointestinal side effects and enhance tolerability. Initiating with a low dose and moderately increasing, it allows the body to adapt to the medication. This approach is based on clinical evidence demonstrating that slow titration of semaglutide, the active ingredient in Wegovy, helps patients better tolerate the drug. It reduces the risk of adverse events like nausea, vomiting, and diarrhea, which can occur when initiating therapy at a higher dose. To ensure proper Wegovy dosing and maximum benefits, adhering to a correct schedule is imperative. As a weekly medication, it is meant to be administered on the same day each week. Before your first injection, it's important to look over all the safety documentation accompanying your Wegovy treatments. It is also a good idea to speak with a medical professional and ask for them to demonstrate how to administer the treatment before attempting to do it on your own. Lastly, before starting treatment, identify your BMI so you know your starting point and so you can track your progress. Wegovy's administration begins with a low dose, which is gradually increased over the first 16 weeks to mitigate side effects. The starting dose is 0.25 milligrams once weekly, with gradual increments every 4 weeks reaching the maintenance dose of 2.4 milligrams. This is to ensure the patient's tolerance and to see the effectiveness of the treatment. We will go into the most common side effects next and how you can avoid or minimize them. As is the case with many medications, side effects don't tend to last for long. Any side effects you may experience from the semaglutide injection will likely disappear once your body adjusts. However, if your symptoms persist, you should contact your doctor or pharmacist for further advice on how to prevent or reduce some of the side effects. They will also be able to assess whether continuing treatment is the right option for you. We will now go into each common side effect in a bit more detail with some recommendations on how to manage the common symptoms. Headaches are one of the most common side effects of taking GLP-1 RAs. They can be caused by dehydration, low blood sugar, or your body just getting used to the change in hormones. If you're experiencing headaches alongside sickness and diarrhea, you may likely be dehydrated. Make sure to rehydrate your body by drinking plenty of fluids and using oil rehydration packets like a liquid IV or LMNT if necessary. Nausea and vomiting are also very common semaglutide side effects. This is because semaglutide works by slowing down the emptying of the stomach, which can result in an upset stomach while your body gets used to it. There are a couple of ways you can settle your stomach without taking medication, including eating bland, low-fat foods, eating foods that contain water like soups, eating slowly, and not lying down after eating. Lastly, get some fresh air. If these aren't working for you and your nausea persists, please contact your healthcare provider. They may be able to prescribe an antiemetic like a Zofran or something like that. Heartburn and acid reflux are also caused by the way semaglutide affects your digestive system. Many people find that changing their diet can help ease their symptoms. For example, by cutting down on caffeine and eating less spicy or fatty foods. As acid reflux is a common problem in people of all ages, there's lots of treatments to relieve your discomfort. Antacids like Tums or Rolaids are over-the-counter drugs that can help relieve symptoms like from the pain and the discomfort caused by the heartburn, indigestion, and acid reflux. While antacids will relieve symptoms for a few hours, they don't treat the underlying medical condition that can cause these symptoms. Gas and bloating can be uncomfortable and in some cases even embarrassing. As with some of the other symptoms on this list, gas can be reduced by eating slowly, eating a balanced diet, eating little and often, and getting regular exercise. You may want to avoid some of the foods that are well known for causing flatulence for a while. This includes beans, sprouts, and cabbage, and then cutting down on soda or other carbonated beverages because that also introduces more gas into your system. When you're taking semaglutide for weight loss, your clothes aren't the only thing that could get looser. Diarrhea is another common side effect of this medication. One of the most important things to do if you're experiencing diarrhea is to stay hydrated. Dehydration can be a serious risk, but drinking lots of water and using oil rehydration packets can help. If your diarrhea is persistent, contact your doctor or healthcare team. Those who don't have diarrhea during their treatment may have the opposite problem, constipation. You may be experiencing constipation if you have any of the following symptoms: difficult or painful bowel movements fewer than 3 times a week, feeling bloated or uncomfortable. Some of the best remedies for constipation are also generally recommended for everyone. For example, eating a balanced diet with plenty of fiber, which can be found in fruits and vegetables, and staying hydrated can also help with relieving constipation. Regular exercise, even something simple like walking, can help to keep things moving. If these remedies don't work, you can ask your pharmacist for a laxative or a stool softener to help things along. The general guidance and best advice to reduce your side effects while taking Wegovy is to eat bland, low-fat foods, eat slowly, avoid high sugar foods and drinks, stay hydrated. And lastly, if any of these side effects are persistent, contact your doctor or healthcare team. Thanks for watching. As a reminder, I have links below to both free and paid meal plans specifically designed for people taking semaglutide, Wegovy, Ozempic, Mounjaro, etc. And if you like this information, please like this video and comment. Lastly, please subscribe if you would like to see more evidence-based nutrition information. For now, be well and take care. See you next time.